Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us for another segment. We're going to be joined by Dr. Louis Ehwerhemuepha, PhD, Manager of Computational Research at Children's Health Orange County, and also Dr. Kenneth Grant, pediatric gastroenterologist, joining us here to discuss some new research led by CHOC that found that for malnourished children and adults who contract COVID-19, the outcome could lead to mechanical ventilation or even death. Welcome to Health Professional Radio, both Dr. Louis E. and Dr. Kenneth Grant. Thank you both for joining us this evening.
Thank you. Thank you.
If you would both, Dr. Louis, if you would explain just a brief look into your professional background, and then Dr. Grant, if you could do the same.
Fantastic. So this is Louis. My background currently working at the Children's Health of Orange County, CHOC, is as Manager of Computational Research, and I've been with CHOC for more than 6 years now, also in the capacity of a data scientist. So in both roles, what we're trying to do at a hospital is to look for quality measures or undesirable events that could occur when a patient is receiving care, and see if we can use data and machine learning and statistics and artificial intelligence to predict when an undesirable event will occur well before the doctors and the caretakers know, but also with the ability to have interventions that could change the course of that event or reduce the morbidity of that particular event. So my team, the computational research team, provides computational services to doctors and other associates at the hospital to conduct these type of investigation and research and work with other teams to deploy them in real time in the electronic health records.
And Dr. Grant.
Yeah, thank you very much for inviting us. I'm a practicing pediatric gastroenterologist at CHOC, Children's Healthcare of Orange County, and I've been at this for a very long time. I'm one of the leaders in our gastroenterology division. I also spend half time working in the field of informatics and supporting the electronic medical record, supporting data analytics, supporting communication. This is my attempt to try and care for more than one patient at a time. There's great joy in caring for one patient at a time, but here at CHOC, we're trying to make a bigger and broader impact on children's health care.
Well, I did say that we were joined by both of you to talk about some new research concerning malnourished children and adults who contract COVID-19. Dr. Grant, could you give us a kind of an overview of this research?
Sure. I'm going to let Louis go into many of the details of the study, but we have been trying to leverage our clinical database for a long time to be able to help predict outcomes for patients. We also have access to a larger database provided by Cerner, and at this time we were looking to try and predict which patients were going to do better and do worse. Perhaps Louis could go into some more details on that study.
Definitely. So as Dr. Grant mentioned, given that at the start of the pandemic, there were few kids getting hospitalized, the data set we used was a big national data set from over 56 health systems in the U.S., and this was provided by Cerner Corporation, a major EHR vendor in the United States. And basically, what we set out to do was to investigate whether patients who have had a history of malnutrition had worse outcomes. One of the reasons why this was an important question to take a look at was that in previous or in other viral infection, we've seen that malnutrition predisposes patients to worse outcomes. And malnutrition in general predisposes patients to worse outcomes on any other comorbidity or condition that they faced. So in this case, we wanted to understand in some ways why would some children have severe COVID-19, where severity of COVID-19 is the need for mechanical ventilation or inpatient death. So all we built the study on was to ask the very simple question, among patients who've been malnourished at some point in time within the last 5 years, before the start of the pandemic, Do these patients have higher risk for progressing into severe COVID-19 versus their peers who've had no history of malnutrition when both are infected with the SARS-CoV-2 virus? So that's the framework of the study. We decided to look at both the pediatric and the adult age group, given the difference in manifestation of the disease in both population, and knowing a little bit about what happens also in the adult group gives us better sense of a contrast with the pediatric population we care about.
So adult and the pediatric population, how many of each and what data was gathered? How did you get the data?
Right. So we gathered the data from what's called the Cerner Real World Database. So what you think about is a structured electronic health records database wherein information such as the vital signs, the diagnosis, what we call clinical events, which is almost every information about the care of a patient when they have contact with the health system, is captured. So at the Children's Health of Orange County, we have our own specific electronic health record system. What we have for the study was up to 56 health systems across the U.S. Their electronic medical record in de-identified format to be able to conduct this research. So between March of 2020 and June of 2020, we gathered over 8,604 data on 8,604 children who were hospitalized with COVID-19 and 94,000 plus adults who were also hospitalized with COVID-19.
And specifically, what did you find out of that number?
What we found here was that over 6% of patients, of children had severe COVID-19 in the data set. Out of these, over 7.5 had a previous diagnosis of malnutrition. But to say this in very simple terminology, our findings is as follows. Patients who have had a previous history of malnutrition prior to the start of the pandemic will have higher odds or risk for severe COVID-19 than their peers, and that this risk changes or increases by age, decreases by age in the pediatric population, and the reverse was the case in the adult population. So in general, malnutrition is a risk factor for severe COVID-19, but the impact of that risk factor depends on the age of the patient.
Well, Dr. Grant, that being said, why did you think malnutrition was a factor in the severity of the COVID symptoms in the first place, in simple terms? And based on that, what are your recommendations for mitigating the problem?
When the pandemic first hit, I think we were all inundated with the risk factors that were supposed to make a patient more at risk for catching or getting sick with COVID. And one of those was obesity. And Louis and I were sitting thinking about this problem one evening, and I said, man, I know obesity is a risk factor, but shouldn't malnutrition also be a risk factor? A patient who's malnourished is more susceptible to infections, has less reserve in order to fight infections. And we were beginning to learn at that point in time that the sickest patients were the patients who were responding to the virus, that were had an immune response or a storm that just chewed up energy and chewed up resources of the patient. So it made sense to think about asking the question, if a patient was really malnourished before they got sick, would they be less likely to survive or recover from the illness? And I think we pointed that out nicely with this study. And it speaks for the fact that we really need to be paying attention to routine care. I think all of us need to be doing that, and that's been very hard in the COVID pandemic because we did not want to come into contact with anyone, and particularly most of us didn't want to come into contact with the healthcare system. And it pointed out that even the sickest of patients were sometimes avoiding healthcare, the routine maintenance that they needed to remain healthy. And therefore, that was putting them at even higher risk if they came in contact with a virus.
And if I may add, this is Louis, is that malnutrition is likely to affect people of lower socioeconomic status, which also buttress the need for programs that addresses food insufficiency within a population, knowing that these already vulnerable subpopulations might be impacted more with viral diseases such as this. I'm going to repeat myself, or I'll repeat that again.
Okay.
So I would like to add that this result also indicates the need for programs to focus on food insecurity, because patients with malnutrition are either patients who are very sick and the sickness induces malnutrition, or patients who are suffering from low socioeconomic or who are in low socioeconomic status. This means that to further protect these vulnerable children or vulnerable population, we need programs that addresses food insufficiency to reduce the additional burden that an already burdened population may be facing.
Well, I do appreciate both of you joining us here on Health Professional Radio this evening. Lots of great information. Thank you both for taking the time.
Thank you.
You're very welcome. It's been a pleasure.
Learn more at www.nature.com/articles. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.